Hey guys, this is Amy from raisingarrows.net, and this is another update on baby Mercy, and this is the one concerning her eyes and kind of an impromptu eye surgery that we weren't expecting. She goes in about every 6 months to have her retinas checked. As part of Stickler syndrome type 1, babies are very myopic, and she has to have her retinas checked because when you are highly myopic, you are at more risk for a retinal detachment. And typically, she goes under anesthesia, and the retinal surgeon goes through her retinas very carefully, checks all the edges and everything. And basically, if he sees something, he lasers it. Well, the last time we had this done was in May, and there was no need to laser anything. Her eyes looked perfect. And then we went in for the routine surgery. Surgery, I say surgery, but we weren't expecting it to be a surgery. Bush put her under and bring her back out. And we got in there, and he said, well, with the Stickler diagnosis that she has now, I'm actually going to go ahead and laser her eyes. Basically, prophylactically. Is that a word, prophylactically? Anyway, for preventative measures, he was going to go ahead and laser her eyes. And he basically said, this is what I would do if it were my child. He said it's not a matter of if her retinas will detach. He said it's a matter of when. And at the age that she is, where she can't tell us if she's seeing things in her vision, we wouldn't know. And he said she is more likely to go blind, and you don't want that. You want her to have the laser done. And yes, it has a chance for making her more myopic, but she's already like a negative 15. So you can't get a whole lot more myopic than that. So anyway, it was kind of one of those snap decision things. I really wasn't even a decision. I didn't feel like I could really say no to that. I felt like it was definitely something that needed to be done, but it was something that happened so quickly that it was a little gut wrenching because I really had it in my head that I was sending her into anesthesia, which is stressful enough, but that, she was going to come right back out of it because there wasn't going to be any issue. He did say when he got in there, her retinas were perfectly attached, looked really great, but he did end up lasering her eyes. 2,100 burns in one eye and 2,600 burns in the other eye. I can't even wrap my brain around that little bitty tiny baby with 2,100 burns in one eye and 2,600 in the other. It's just crazy amount of burns. And so it took a little while, but brought her back out. This time they actually gave her some meds to bring her out of surgery, and that was a real blessing because Mercy comes out fighting. She's always been a fighter, even when she was in NICU and they would bring her out from anesthesia from her surgeries while she was there. I mean, she just came out flailing and crazy baby. And so they gave her some meds this time because last time was a nightmare. And she came out of surgery a lot calmer, and she had her little quilt that she likes to hang on to. She plays with the binding and makes a cute little noise, and so she felt much more relaxed. And then they took us down to the waiting area and just waited till she was a little bit more awake, and then we took her home. So it was an in and out procedure, but it was just a little more than we were expecting. I also wanted to show you something new with her glasses. First of all, like I said, she is negative 15, so you can see how thick. I mean, it's raised up out of these Miraflex glasses. Um, the Miraflex are really nice. They're silicone. I mean, they just fold up like this for babies. They've got the little band in the back that just clips on. But they have something that she desperately needs that is a new thing for us, and that is the little nasal bridge here. Now, it is terribly discolored, and that is something I don't like about this. Miraflex is notorious for like their white colored glasses and their more clearish colored, their lighter ones, um, discoloring. And this nasal bridge here that builds up the bridge because Mercy has midfacial hypoplasia, which means she's very flat across here. Um, and because of that, her nose is very tiny. And this nasal bridge on the glasses helps raise that up and then keep those glasses away from her eye because what we were running into without the nasal bridge was her glasses were constantly fogged up, and I couldn't find any way to make them not fog up because without the nasal bridge, her glasses were just right up against her eyes. So the simple putting in of a nasal bridge on the glasses totally fixed that. Her glasses never fog up now. The reason I'm not really super concerned about the nasal bridge being so discolored at this point is I think we're getting kind of close to Mercy needing a new pair of glasses. So that's going to change anyway. I think she's probably going to need the size up. We did buy the plan with these glasses that allows us to change out the lenses 3 times in the lifetime of the glasses. We've already changed them out once for scratches, and I just kind of keep a close eye on them to see when I might need to do that. I also wanted to show you, here's her prescription. I mean, you can see that this poor little girl, she's not seeing real great without these glasses. So people ask me, how does she keep those on? And my answer to them is number one, she's had them since she was 6 months old. And number two, she knows she can't see without them. She would much rather see. So she leaves the glasses on. We've really had no issue with her. She's 15 months old. No issue with her trying to pull her glasses off. Every so often, she gets them pulled off for one reason or another. Like they start to come off her ear for somebody hasn't put them on well enough. And then if they're like off her ear, she will kind of pull at it because it doesn't feel normal to her. But really, she has not, she just doesn't mess with them. She likes her glasses a lot, and so that's been a real blessing. She will have to continue to go in about every 6 months for a while here and be put under anesthesia and have her eyes looked at again until she is able to be checked in office without pitching a fit. And so I don't know how long that's going to be. They are talking that at some point they will put her in contacts to get the lens even closer to her eye. Um, I have not had a follow up appointment to see if her myopia has worsened because of the surgery. That would be unfortunate, but I realize that the preventative measures are more important. And that we just don't want her to go blind if we can possibly help that. And so having him laser her eyes was the best option for us. If you have any questions about Stickler syndrome type 1 or about high myopia in children, I have a couple of resources that are really great for you. There's Stickler Involved People is a website, and then Little Four Eyes. I think they've just changed the name though, but there's a Facebook group, and then there's also a myopic group that is very specific to the needs of myopic patients. And that's also on Facebook. But I'd be glad to answer any questions you have as well. Um, there has been a lot of talk about Miraflex not being the best kind of glasses for someone with sticklers because of the hypoplasia. But with the nasal bridge on there, I think they are just as good as some of the others. I've really been impressed, and I was really glad that the optical shop where she gets her glasses actually switched them out for us free of charge. So that was fantastic. Yes, she has little purple glasses at this point, and I'm trying to decide if she's going to continue to be purple with her next pair. I don't know. It's funny how her wardrobe sort of revolves around the color of her glasses, but it's been fun. It's been interesting for me to have a child with glasses. I've never had a child with glasses that was this young, and I only have one other child who has glasses, and he got them when he was about 10. So this is a little different for me, and it's been a learning curve for sure, especially with the myopia, and then with the extra issues with the retinal detachments. You get quite an education when you have a child who has particular needs. And I think it's been good. I think it's good for parents to really dive in there and get involved and understand their child's diagnosis and understand all of the facets to that diagnosis, including, something like eyes and ears and all the extra things that go along with it. You are your child's best advocate. And when you have all the facts, you can make really good informed decisions about their health care. And that is tremendous. So again, if you have any questions, feel free to ask. And hopefully we will be back again sometime with Mercy. She just got too tired to stay up any longer. But you can watch the previous video where she had her cleft palate repair, and she actually says some pretty cool words for you. So that's pretty awesome video. You can check that out by clicking on the button, and we'll see you next time.